a trained medical laboratory technician in Golaka Specialist Hospital. Okay, so today I'm going to enlighten you about the time frame of malaria and typhoid test that we do. As for malaria, it doesn't take much time. From 30 to 40 minutes, you get your accurate malaria test done. As for typhoid test, it doesn't take much. You just have to centrifuge the blood, get the serum, then 20 to 25 minutes, you get your typhoid result done. I think that's all about the time frame of the typhoid and the malaria.
Hey everyone, my name is Nurse Joy, the Patient Relation Officer in Golaka Specialist Hospital. So today I will tell you about malaria and typhoid. First of all, what is malaria? Malaria is an infection parasite transmitted by a female mosquito. What are the signs and symptoms of malaria? First of all, there is weakness, there is headache, there is high fever, there is general body weakness, there is loss of appetite, you see lost weight, you see dehydration, and all of that. So the best way, before taking a treatment, you have to run a test, because you cannot just go and take malaria. Malaria treatment, because malaria and typhoid symptoms come almost the same. So if you go and you don't know, maybe it's for typhoid, you go and treating for malaria, it might cause complications. So you have to do a proper testing first before you go for the treatments. And again, you might have the malaria, yes, but it might not be too high or it might be too high. So you have to know the exact malaria parasite that you have to know the kind of treatment to take, because you might have a very high malaria parasite, but you go ahead and take a very low effective drugs that's just for a minor malaria, so it won't work. That's why some people will be like, oh, I just treated malaria a few months ago and I'm sick again, because you didn't do proper testing. You just went to the pharmacy to take treatment without proper testing. Okay, so what is typhoid? Typhoid is a bacterial infection caused by a contaminated food or a contaminated water when ingested, when it's into your body. What are the signs and symptoms of typhoid? As I said, typhoid and malaria symptoms are similar, but very little bit difference. For typhoid, there's headache, there's weakness of the body, there's loss of appetite, there's diarrhea, there's vomiting sometimes, it might not come every time, there's loss of appetite, there's weakness of the body, there's dehydration, and all of that. Okay, so what are the prevention of typhoid and malaria? So as for typhoid, you make sure when preparing your food, you wash your vegetables very well. You get it from a good source, not a vegetable that has been there for a week, like fresh vegetable from the farm. You wash it. While cooking, your pots, your surrounding where you are cooking. When you are done, also you preserve your food very well and cover it very well. And if you have children, if they eat, be sure of their surrounding. When they eat, they drop things on the floor. Don't allow them to pick it up and eat it again. So for malaria prevention is using insecticide, using nets to sleep, and rubbing mosquito